Yes. Good afternoon, everyone. I am here to present the article summary presentation for Group 5. There are 5 people in our group. Disha Bilave, Ms. Disha Bilave, Dr. Sneha Bagle, Ms. Pratiksha Sable, Dr. Vedika Dadlani and myself. Our article title is Strengthening Science, Technology and Innovation-Based Incubators to Help Achieve Sustainable Development Goals, Lessons from India. Here, if you will see, the case study of India, like case studies from India is analyzed for evaluating the effect of STI-based incubators in achieving these sustainable development goals. Now, presenting the key principles practices from the article. See, the public-based incubators or policymakers, all these governing bodies see science, technology, and innovation as an, I would say, avenue for meeting the sustainable development goals through focusing on employability and I would say employment, economic development, social development, and meeting unmet market needs for efficient delivery of services I would say. Now, if you will see the sustainable development goals, there are altogether 17 sustainable development goals. Earlier it was referred as, the terminology that was used was societal goals. Now the terminology that is used all over the world, I would say, it is sustainable development goals. These are enlisted over here. You can see from number 1, no poverty, 0 hunger, good health and well-being, quality education, gender equality, and so on. Now, in our article, if you will see, it was based on 2 research questions in and all. First was, to what extent have STI-based or science, technology, innovation-based incubators and the startups historically helped to implement the development objectives in developing countries? And the second research question was, how might they better help achieve, or how they could have better helped in achieving the sustainable development goals. Historically, if you will see, in our country, already it was operational. Governing bodies, or I would say the policy makers, or the public-based incubators, they were working on overall society, like economic development and societal development, like for improving the economic, for doing the economic development and societal development, I would say. Now here in this article, if you will see, it was based on 3 perspectives. Here the India's incubator experience, it was analyzed from 3 perspectives. Firstly, by focusing on policy drivers, where the thing that was analyzed by author was why publicly funded incubators were created. Secondly, by focusing on public agencies responsible for designing and implementing government-led programs for supporting STI-based startups. where this thing was analyzed by like in terms of what these agencies did to implement policies using incubators as intermediaries and what were the outcomes. And lastly, the perspective was by focusing on actual incubators. Here it was analyzed by evaluating how incubators have been effective in context of implementing societal goals that map to the SDGs. Now, STI policy has emphasized on three areas: strengthening supply side of STI, wherein by promoting science and technology-based education, setting up R&D labs, creating science and technology-based large public enterprises, and improving IPR. Second area was by supporting entrepreneurship at large. Here, by implementing by implementing policies and programs that finance small and medium business or startups, easing regulatory barriers to start or end a business. And lastly, the area was strengthening links between STI, entrepreneurs, startups, and markets. So it was done by setting up incubators, technology transfer centers, and science parks. Now, the challenges that were faced by STI-based startups during analysis, it was found. The first one is startups are risky by definition, if you will see. And what were the risk here in early stage startups, if you will see? The risk of technology failure, the unavailability of infrastructure to support technologies, lack of technology trained human capacity. All these were this was the first challenge. And the second one was success of STI based startup. It depends in multiple ways on private sector. But because of multiple market failures in developing countries, the private sector has undervalued the long-term societal benefits. And the market failures include, if you will see, lack of resources or to test or validate risky STI-based ideas, paucity of early adopters willing to take up new technologies, lack of long-term investment in STI-based startups, and the low monetary returns for public goods related to SDGs, despite their high societal benefits. Now, here in the article, as I said initially, there were two research questions. The the implementation or effectiveness of STI policy was evaluated. It was assessed. It was assessed by in terms of three parameters, I would say, or in three ways. Why incubators were set up, that was first analyzed. What was the reason behind it? Then what various stakeholders involved in incubator activities did, and what were the outcomes? And lastly, how they were able to implement SDGs. So why incubators were set up? As I said initially, it was existing in India earlier also. They were playing significant role in economic development and altogether the entrepreneurial development or entrepreneurship. They have already taken that initiative. So it played significant role in attainment of STI-based policy goal from 1980 till mid 2010, and it was mapping with SDGs. Now it's called as SDGs. So SDGs 8 and 9. It was mapping well with SDGs 8 and 9. Now, if you will see why they were set up, what was the reason or behind that? Role of incubators. To generate employment through generation of small new enterprises, building academia, industry, and science technology linkages, and supporting technology transfer. So that was the I would say motto behind setting up incubators. Now, if you will see the progress, how the incubator, the public-based incubators, how the evolution is from in 1980 to 1984. if you will see, DST came into picture, like the Department of Science and Technology initiated the schemes called as NST, EDB and STEP. Later DBT, TBI, then TBI seed fund for startups, then Department of Electronics and Information Technology came with TIDE scheme and so on. And now if you will see, recently, not I will not say recently, in between 2012 to 2016, all these schemes, or I would say incubator programs came. It was set up, it was initiated. DBT via BIRAC Big Biotechnology Innovation Grant, ATAL Innovation Mission, Startup India Action Plan. So this is how it evolved. And the second question was, as I said, what various stakeholders involved in incubator activities did, and what were the outcomes. So here, just like who all were involved, which all stakeholders are involved, that only I will discuss here. STI based in how they were working, how they were operating. STI based incubators operate on as a not profit for organization or not profit for entity or as a company. Most incubators are set up with a host academic institute or R&D laboratory, with the expectation that the host provides technology infrastructure which is needed for STI along with space and other basic facilities. And in addition to this, indirect support, funding in their incubating startups by attempting to strengthen network with private investors, like angel investors and venture capital, etc. This was playing a key role there for supporting incubators. And if you will see, most incubators are in clusters around metropolitan tier 1 cities that have strong industrial presence. So here, few I would say incubators you can just see, like SIGN, then DBT, then CIIE. CIIE is Center for Innovation, Incubation and Entrepreneurship. SIGN is Science of Innovation and Entrepreneurship. Now lastly, how incubators implemented STI-based entrepreneurship for SDGs, for attainment of SDGs. By identifying and attracting innovators through capacity building efforts. Here, the incubators like CIIE offered internship opportunities at the incubator, fellowships for student entrepreneurs, prototype grants, and again by offering specialized courses. Then addressing unmet market demands. Here the incubators like CCAMP and IKP addressed specific challenges for biotechnology and life science startups by offering targeted mentoring, equipment, technical expertise and industry linkages, providing access to financing for startups, by strengthening startup networks, by managing incubators effectively. But despite the large presence of incubators in urban metropolitan clusters with strong industry presence, it was found that the actual linkage of most incubator with industry had been weak, and there is need to have more robust monitoring of performance. So that was just, and the concluding remarks or learnings from this article, if you will see, incubators and where the improvement is needed. That is and how the I would say framework should be. Incubators and public agencies involved in incubator ecosystem should explicitly align their existing goals and objectives to the SDGs to set clear targets. Incubator systems should be coordinated at the national level to prevent the proliferation of intermediaries or the redundant programs. Countries with an existing incubation system that do not have robust monitoring of performance should develop such a framework before setting up new incubators. And a robust incubator policy is just not enough. There is need for human capacity building, like that focus should be there. while carrying out all these activities for mapping it with the SDGs. So just I will go to this was about key principles. Now just application of these principles and practices in like my, I would say, field, I will explain it here. By designing and working on projects addressing unmet needs that would improve quality of care and would translate into societal benefit as a whole. By collaboration with industry working in the same segment and designing scalable and commerciable product. And these are mapping, if you will see, first outcome application is mapping with G3, quality education, and then G17, it was related to healthcare system, G3. Collaboration with industry working in the same segment and designing scalable and commercial product, it's the under innovation and innovation SDG. Then submission of well-structured and well-defined research proposals addressing unmet needs to STI-based incubators like DPT, DST under respective schemes. Again, for infrastructural development, again one can approach the incubators like these policy makers like DPT and DST for the grants like Modrov and all. Contributing towards holistic development of students and sensitizing students to social and economic issues and making them to contribute in improvement of the same. For say by planning visit, arranging visit and donation to orphanage, participation in social awareness camps, volunteering in blood donation camps, workshop on gender equality and all. So these were mapping the SDGs 1, 2, 4, 5. And lastly, by contributing towards establishing research and innovation ecosystem in academia that would positively impact on careers of students by inculcating the research instincts and boosting innovative entrepreneurship. And this thing we are learning here. VS has given that opportunity. We are fortunate. We are getting that inputs, and definitely we will percolate that to our students. Thank you. Now I will hand over to Sneha.
Thank you, ma'am. So the application from this article which I would take away is the main purpose of this article was to attain at least maximum SDGs we can. So keeping this aim in mind, I have listed some objectives. First is building a need-based interdisciplinary learning system. There is no dearth of knowledge available here. With a click of phone, the knowledge is available right from the 1980s to 2030s and what would be the knowledge in 2050. So there is no dearth of knowledge. There is a dearth of application of this knowledge. So as teachers, as facilitators of education, if we could train the young minds to think in a very tangential way, how this knowledge can be used and applied to meet certain demands in the market, or maybe at your home, it would start from your home itself. So the basic first thing would be to train these minds to think in a way which no one else is thinking right now. So the first aim would be to train them to think out of the box, to think very laterally. Because teaching HFP in first year, the main question students ask is why they have to do RBC and WBC evaluation using Yuva Shiver. Ye to Baba Adam ke zamane ka technique. But if you have the question of why we are using this, you can definitely answer how we can better it and what are the ways to better it out. So if you have questions igniting in the mind, you'll have different questions to answer the current unmet needs. So as teachers, we would ignite the minds to think, this is the knowledge and where you can apply it. Second is developing critical thinking, and also it is an interdisciplinary learning. Through this ATAL FDP, we have been taught that there is need of a multidisciplinary and an interdisciplinary thinking. So if using pharmacology, if I can, test a formulation, I can evaluate a new compound. So there needs to be an interdisciplinary thing, because if my students are doing some toxicity study, this toxicity study could be done from a medium background, wherein new drugs are synthesized and then synthesized drugs would be used for toxicity. So interdisciplinary approach can be used. This will save the time Save the time to reach to a particular aim, to reach to a particular target. So time would be saved, your resources would be saved. Third is, I would say our college represented SIs, that is Smart India Hackathon. At Smart India Hackathon, the problem statement was a software-based problem. So as a pharma institute, we have science, we have innovation. The lack of it is technology. So using collaborations with technological or technical institutes, we could have that upper hand wherein we can use our science knowledge, wherein we can ignite our innovative minds, and taking support of this collaboration, we can definitely enter or venture into entrepreneurship and startups. This could be very easily done because we can have a team up or collaboration. I come from DY Patil, so at DY Patil in the umbrella university, we have many colleges like medical, we have technical colleges. We can use this collaborations at our help, and we could come up with different knowledge or different technologies to meet the unmet demands of the market. So lastly, collaboration with technical institute to tackle science, technology and innovation. Or else we can tie up with a technology-based incubator. We do not have an incubation center at our college. So tying up with a technology-based incubator could be one of the ways or one of the shortcuts used to attain our goal of entering into startup or entrepreneurship. Lastly, building a strong alumni. If our alumni is really strong, we will not have to worry about investors, will not have to worry about their knowledge base. If we have strong alumni, we can call them anytime for a lecture, maybe for a session, maybe. If we have this problem, how could you as a innovative mind tackle or help our students tackle this problem? So if we have a strong alumni base, we'll have a strong knowledge base, we'll have strong investors. We don't have to go through various incubators or go through various funding agencies to allow them to just give us grants. If we have a strong alumni, they'll help us generate that fund, generate that knowledge base. So the key takeaways from this article would be this. So by doing this, I think by doing the first objective, we'll try and tackle the SDG 4, that is quality education. Then the third, being from the pharma sector, the third SDG could be attained, and the ninth and the 17th SDG. So at academics level also, we can target maximum SDGs which we can attain and help for our societal and our economic development of our country at large. Thank you.
So the applications which we practice at our institute or myself first is quality education. Quality education is not only giving lectures or classroom teaching, but it is also understanding the social, emotional, mental, physical and cognitive development of each student. For that, one concept we have in our college is the mentor-mentee skill or the concept. So, wherein every student has a mentor, wherein the mentor guides the student in every part of its life. Next is also we provide e-content and video. The next goals we have is industry innovation and infrastructure. So various innovation and entrepreneurship development programs are there which we take frequently. Recently only we had organized an impact lecture series on topics like innovation, startups and entrepreneurship ecosystem enablers, then from startup to scale up, where we invite entrepreneurs from outside, where they share their real life experience from to become an entrepreneur, the problems they have faced, their success, the failure, so which will guide our students to become a successful entrepreneur. Next is a college research committee also works on strengthening research skills as well as building innovation ecosystem in faculties also. For that purpose, we conduct lecture series on every Saturdays for faculties, wherein the in-house members or members from outside are invited. Recently only we had research and innovation in pharmaceutical science lecture by Mrinal ma'am. Next is partnership for the goals. We have collaboration with many industries, labs and educational organizations. One is Global Education, wherein this organization helps the students to guide in their career. Next is the Quality Solution Laboratory from Belapur. This Quality Solution Lab, we have signed MOU with this wherein every year we have the analytical lab visit. Also, they outsourced, they give us outsourcing of various analytical samples, hands-on training to the students, and also they allow our students for internships. So, what I think is not only few goals, but all the SDGs would be implemented by us to reach the SDGs by 2030. Thank you.
With STIs and SDGs in discussion, our team works, I mean my research students work with CAD, that is computer-aided drug designing, and we have been effectively using this process for efficient, STEM, economic and selective synthesis of target compounds. And I think that with this we are able to achieve our sustainable development goal number 12, which works about responsible consumption and production, so that we do not waste enough of chemicals and we synthesize smartly and effective molecules are generated. Further, our M.Pharm students also work in the area of synthesis and evaluation of novel anti-infective molecules. Thereby, we are trying to achieve our SDG number 3 for good health and well-being of individuals. Also to say, with instrument room in our in charge, we outsource facilities like HPLC, IR, UV, particle size analyzer, biochemical analyzer for projects for other colleges as well as industries, and we do also welcome collaborative projects with industries, and thus we try to achieve SDG number 9, which is industry innovation and infrastructure. And lastly, we address SDG number 3, that is quality education at college level by inculcating theoretical knowledge, practical skills, attitude and ethics in pharmacy to cater services to industry, academia and society as a whole. Thank you.
Good afternoon, everyone. I am Nisha Kudarik from Konkan Campus College of Pharmacy as Research Institute. So, to attend the few of the SDGs, with respect to good health and well-being, we have taken certain steps like different health checkup camps and different vaccination camps have been arranged. Then different awareness programs, different health awareness programs for the nearby villages has been arranged to improve, to fulfill these goals, to achieve the good health and well-being. Then our diploma students are trained in such a way that they can effectively counsel the patient. Then we adopted 5 nearby villages under the government scheme of UBA, that is Unnat Bharat Abhiyan, for their development. Then with respect to quality education, we not only focus on the theoretical knowledge, but also the social, emotional, physical, mental growth of the student. For that, they have been continuously motivated by mentoring. They are guided by different seminars, and the mentors are provided to continuously guide them. Then different library facilities and modern technologies are provided to achieve their goals in the education. Then different motivational seminars, a series of seminars on the positive thinking have been arranged for the student for keeping them motivated. Then with respect to industry innovation and infrastructure, we have signed MOUs with the different organizations as well as industries. And then every year we are arranging the industrial visit for the development and for the gaining knowledge of the students with respect to the industry. Then with respect to life and land, to keep to support the ecosystem, to maintain the environment on every environmental day, we plant the more and more trees, and we are having more than 2,000 trees, and the survival rate is 97%. Then again, to support the ecosystem, the vermicomposting is done within our campus, and all these measures are being taken to help to support the ecosystem and hereby to conserve the forest. These are several steps which are being taken to achieve the different SDGs. So that's it. Thank you.
The last question was key takeaways from the article. So we have listed three main key takeaways from the article. That is building a triple helix model which includes the academia, industry, and the government bodies. So there is no gaps or there are no loopholes wherein a startup or an entrepreneur cannot flourish. So the triple helix model will help in the development of a successful entrepreneur or a successful startup venture. Second is targeting research that meets the SDG goals at the academia level. So at the academia level, when we are planning a research idea or a problem statement, the aim of that research idea or problem statement should be to reach or attain certain SDGs. And to attain those certain SDGs, we can jot down various objectives through which we can attain those SDGs. So by doing this at academic level only, we are able to attain those SDGs. Lastly is building an ecosystem which is startup ready and entrepreneurship friendly. So if we have an ecosystem that is strong enough, then we have the science, we have the technology, we have the innovation, and then we can bring in investors by supporting or by making clusters of our alumni base. We can have a successful ecosystem in which the entrepreneurs and the startup can flourish, and it would be easy for the student to think in that way that if I have an innovative idea, I can take up this and can build into a startup. So at college level only, we are not making the students employable, but we are creating such minds that they think that we can employ people under our company or under our startup. So these are the three main takeaways. Thank you.